So on page 186, we see two types of meds that are approved for sleep, and one are benzodiazepines, actual benzodiazepines, and then we have benzodiazepine agonists. They're going to end in either PAM or LAM, and they have AZ in their generic name, like I said. There are a few benzodiazepines approved for sleep. So they bind to the benzodiazepine receptors, which we have in our central nervous system. They enhance the effect of GABA in the brain and sort of decrease the response of the nervous system. So we see astaxanthin, flurazepam, temazepam, which is also called Restoril. And I want to call your attention to the benzodiazepine agonist section. They give some drugs you might recognize, Lunesta, Sonata, and Ambien, but they also talk about lorazepam or Ativan. That should not be with the benzodiazepine agonist. That should be with the actual benzodiazepine. So we will consider that as being part of the benzodiazepines. You don't want to take these with other central nervous system suppressants like alcohol, opioids, even too many antihistamines can cause a problem. If a woman is taking these and continues taking them when she's pregnant, there can be a high risk of birth defects. Because they're central nervous system depressants, they're going to cause impaired judgment, and you might not remember things that were done. And it's a good idea to only take these drugs if you have the chance to get a good sleep. If you are out late or get home from work and you don't get to bed until 2 or 3 in the morning, it's probably not a good idea to take one of these drugs, because they're going to last for about 8 hours, and if you have to get right up again after just a few hours sleep, you're going to be hungover. So you want to take the drug and go to bed fairly early and try to get a good night's sleep. Now, benzodiazepine agonists will occupy the benzodiazepine receptor, will also enhance the effect of GABA and sedate you. These particular drugs, Lunesta, Sonata, and Ambien, are very familiar to anybody who watches TV. Lunesta is thought to sometimes cause a metallic taste and agitation if it affects you a little bit differently. We're very, very, very familiar with the memory impairment that Ambien can cause. The other drugs too, to a certain extent, but Ambien's kind of famous for it now, and there are a lot of horror stories out there about people who have taken Ambien, especially if they combine it with alcohol. And you don't even have to like wash the Ambien down with alcohol. I've heard stories of people who just had a beer or two in the course of a day's festivities, and then they take Ambien to go to sleep, you know, not even showing any signs of having had alcohol earlier, and they combine and they do things that they don't remember later. They do things that they would not do ordinarily, and sometimes they will engage in different kinds of sleep activity. Sleep eating is a real common one. Somebody gets up in the middle of the night and just eats their way through the kitchen, and they don't remember it, and they wonder why they're putting on weight or why they wake up in the morning, you know, surrounded by candy wrappers. It's a good idea if you're going to start taking these sleeping medications, if you have family, alert them and have them kind of monitor you during its initial use. Don't take with other central nervous system depressants, and once again, don't take it if you only have a few hours. You want, you know, a good 8 hours sleep, even longer if you possibly can. The next thing we'll be talking about are different kinds of psychotherapeutic agents. We're going to talk about anxiety. We'll end up going on and talking about depression. Like I said, we will talk about antipsychotics, only in the ATI book, and then drugs for the mania that accompanies bipolar disorder. We're going to go to anxiety because the same drugs that help with anxiety are ones we've talked about when we've talked about sedative hypnotics. And here you see the vicious cycle that people get into when they suffer from anxiety. It can lead to panic, which can just cause sympathetic neurotransmitters to go wild, and then you crash and you feel depressed and more anxious, more panic, more depression, and it just seems to be a roller coaster people can't get off. So on page 186, we see similar drugs that are approved for anxiety. So Xanax, Valium, and Ativan are frequently given when a person has an anxiety disorder. Now, anxiety in and of itself is not a bad thing. It can be good. Anxiety about how you're going to do on a test is what makes you buckle down and study. Anxiety about not being able to pay bills, make your rent or buy food is what gets us out there working our job, even when we might not feel like going. When anxiety becomes a problem is when it interferes with your ability to just live day to day. And in these cases, some people end up talking to their doctor and sometimes getting an anti-anxiety medication such as a benzodiazepine to kind of help use GABA to calm their minds down. Now, ideally, you don't want to treat an anxiety issue with just medications. You want to maybe take the medications while you seek therapy and develop some coping methods. That's what's recommended. But with our kind of wonky medical care system and mental health system, sometimes people slip through the cracks and they don't get the therapy and the coping training they need, and they're just put on meds and left to go. We talked about flumazenil for a benzodiazepine overdose, as well as the lifespan consideration about patients being 65 and older. Benzodiazepines are not really recommended for patients in their geriatric years, and definitely not if they already have dementia or have already injured themselves from falls. Benzodiazepines are stored in adipose or fatty tissue, and so as we age, we tend to lose muscle and put on more adipose tissue if we don't really carefully watch our diet and keep exercising. And so the benzodiazepines can be stored and take a longer time to get out of the system. We can take these medications, the benzodiazepines, to produce a calming effect and sort of suppress the central nervous system. This will sort of relieve that anxiety that we feel either from situational issues or just because of our own sympathetic nervous system kind of turning on us. We also can use anti-anxiety agents for alcohol withdrawal symptoms because alcohol has a sedating effect on the brain. If you stop drinking, the person can have abrupt withdrawal from alcohol and can have seizures. It's used as a anti-anxiety agents are used as pre-op drugs and sometimes to relieve muscle spasms. Valium is a very potent antispasmodic for injuries or conditions in which the muscles are spasming.